Welcome to the deep dive. Today we're tackling a really interesting area, the global market for coated endotracheal tubes.
Yes, it's quite specific, but pretty significant, as the report you shared shows.
Exactly. And that report looks pretty detailed, projecting growth and breaking things down. Our mission here is really to extract the key insights, the size, the growth drivers, regional differences, that kind of thing.
Right. The source gives us a good snapshot. It focuses specifically on these endotracheal tubes, breathing tubes, essentially, that have special coatings.
Coatings for what, primarily?
Well, usually antimicrobial, so preventing bacterial growth or sometimes lubricating to make insertion smoother. The report gives us numbers for 2025, forecasts out to 2033, growth rates, regional shares, all the good stuff.
Okay, let's jump right in then. The size itself, what are we looking at globally for this year, 2025?
It's estimated at USD 2,134.84 million. So over $2.1 billion.
Wow, okay. That's a pretty big market for such a specialized device, and it's growing.
Oh, yeah, significantly. The forecast puts it at USD 333.15 million by 2033.
So well over $1 billion in growth in, what, 8 years?
Exactly. That works out to a compound annual growth rate, CAGR, of 6.50% between 2025 and 2033.
6.5% CAGR. That's solid. What's fueling that? What's pushing the demand?
The report highlights, well, mainly two things. First, just generally more surgical procedures happening worldwide.
Right, more surgeries, more need for anesthesia, more tubes.
Precisely. And second, a rise in critical care admissions, more patients in ICUs needing mechanical ventilation.
Got it. So higher volumes in surgery and critical care are the core drivers. Makes sense. Now, how does this break down geographically? Where's the biggest market currently?
North America is the leader right now. It holds over 40% of the global share.
Over 40%, okay.
Yeah, the market size there for 2025 is pegged at USD 789.89 million.
And its growth rate, is it keeping pace with the global average?
It's respectable, but actually a bit lower. The projected CAGR for North America from 2025 to 2033 is 5.0%.
Okay, still growing, but not the fastest. Within North America, is it mostly the U.S.?
Definitely. The U.S. makes up the lion's share. USD 623.22 million in 2025 with a 4.8% CAGR.
Right.
Canada's next, around USD 94.79 million, but with a slightly higher growth rate, 5.8% CAGR.
Oh, interesting. Why higher in Canada?
The report suggests it's linked to, their growing elderly population and also a higher prevalence of chronic respiratory diseases.
I see. And Mexico?
Mexico is estimated at about USD 71.88 million for 2025, growing at a solid 5.5% CAGR.
So what are the key factors really pushing the market in North America as a whole? You mentioned surgeries and ICU admissions already.
Yes, those are fundamental. But also there's a big focus on reducing ventilator-associated pneumonia, VAP, and other hospital-acquired infections, HAIs.
So the coatings are seen as a key part of infection control.
Exactly. Demand for antimicrobial coatings is rising because of that awareness. Plus, you have ongoing tech advancements in the coatings themselves, making them better.
Okay.
And then add in, relatively favorable regulations, strong healthcare infrastructure, high spending.
Yeah.
It all contributes.
Got it. So a mature but still growing market focused on safety and tech. Let's hop across the pond. What about Europe?
Europe's the second largest market. It accounts for over 30% of global revenue.
Still a very significant piece.
Absolutely. The projected size for 2025 is USD 619.10 million. And their growth is expected to be slightly higher than North America's, actually, at a 5.6% CAGR through 2033.
Okay, 5.6%. Which entries are leading in Europe?
The big ones are Germany, about USD 122.58 million in 2025, with a 5.8% CAGR. Then the UK, around USD 104 million, but with quite strong growth at 6.4% CAGR.
Higher than the European average there in the UK.
Yeah, and Russia is significant too, about USD 95.96 million, though its growth is a bit slower at 4.6% CAGR. France, Italy, Spain are also important players.
And the drivers in Europe? Similar story to North America.
Largely, yes. Concerns about VAP and HAIs are definitely a major factor. Europe often has quite strict healthcare regulations focused on patient safety, which kind of pushes adoption of these advanced tubes.
Right.
You also have the aging population factor, rising ICU numbers, ongoing technological improvements driven by R&D investment, sometimes helped by government funding too.
Okay. Now, the region everyone seems to be watching for growth, Asia Pacific. What does the report say about APAC?
Right. APAC currently holds about 23% market share, so smaller than North America or Europe right now. The 2025 estimate is USD 512.36 million.
The growth.
That's where it gets really interesting. The projected CAGR for APAC is 9.2% from 2025 to 2033.
Wow. 9.2%. That's significantly higher than the global average.
By far the highest regional growth rate projected in the report. Huge potential there.
Which countries are really powering that growth in APAC?
China's the biggest market in the region, expected to be around USD 215 million in 2025 with an 8.7% CAGR. Japan is next, about USD 70 million, 7.7% CAGR.
Okay.
But the standout, growth-wise, is India. Its 2025 market size is smaller, around USD 51 million, but the projected CAGR is a massive 11.1%.
11%? That's incredible growth. What's driving this boom across APAC?
It's a mix of things. Rising healthcare spending overall is a big one. More access means more surgeries. Growing awareness and prevalence of VAP is also pushing demand for better tubes. Then you have factors like expanding medical tourism in some countries, government investment in healthcare infrastructure, and infection control.
Right.
And like elsewhere, the aging population and more ICU admissions are boosting demand too. It's sort of a perfect storm for growth in this sector.
Definitely sounds like APAC is the region to watch closely. What about the other areas? South America, Middle East, Africa, are they significant?
They have smaller shares currently, but still showing decent growth. South America is over 5% share, about USD 81 million in 2025, with a good 7.2% AGR projected.
Okay.
Brazil's the key market there, and Argentina actually shows a very high growth rate, around 8.1%.
Right. And the Middle East?
Around 2% share. About USD 85 million in 2025, but with a strong CGR of 7.8%. Saudi Arabia and the UAE are growing particularly fast, over 8% CGR each.
Impressive growth rates there, too.
Yeah.
Africa?
Smallest share, about 1%. Roughly USD 47 million in 2025, but still a healthy projected CAGR of 6.8%. South Africa is the main market, and Nigeria is showing good potential too.
And are the drivers in these regions broadly similar? Infection control, more procedures?
Yeah, largely the same themes play out: rising VAP and respiratory infections, more hospitalizations, healthcare reforms, growing awareness of infection control, expanding private healthcare in South America.
Okay.
In the Middle East, you see similar drivers, plus strong infrastructure investment and medical tourism. In Africa, it's about increasing healthcare investment, rising surgeries, growing awareness, and partnerships with global firms. So while smaller now, the potential is there across the board.
This gives a really great global overview. The report also gets into market segmentation, right? By grade and application. Can you break that down?
Sure. So looking at grade outlook, the report expects the electronic grade segment to be the biggest.
Electronic. What does that mean for an endotracheal tube?
It means integrating things like sensors and monitoring systems directly into the tube. Think real-time tracking of placement, airflow, that sort of thing.
Ah, smart tubes, basically.
Exactly. The idea is it enhances patient safety, helps reduce complications like VAP or accidental dislodgement or obstruction.
That makes a lot of sense. What other grades are mentioned?
There's technical grade, metallurgical. But interestingly, the report highlights the ophthalmological grade as the fastest growing segment.
Eye surgery.
Yeah. Apparently, using specialized coated tubes during eye surgery helps minimize irritation and potential complications in those specific procedures.
Huh. Didn't expect that one.
Yeah.
Okay, what about segmentation by application outlook? Where are the coating technologies being applied?
So this one might seem a bit counterintuitive at first. The report says semiconductor manufacturing holds the largest share by application.
Semiconductor manufacturing, how does that relate?
It's about the techniques. The report explains that advanced methods used in making semiconductors, like thin film deposition, are actually being adapted to create these very precise antimicrobial and biocompatible coatings for the medical tubes.
Wow, okay. A real crossover technology application. That's fascinating. What's the next big application area then?
The pharmaceutical segment is pegged as expanding rapidly. This is more straightforward. It's driven by the demand for coatings that prevent infections and improve patient safety during drug delivery or critical care. Pharma companies are investing in this to improve outcomes.
Right, back to that core theme of safety and infection prevention. Now let's recap the drivers, restraints, and trends. We've touched on many drivers already.
Yes, the big ones are advancements in medical tech making tubes safer and better, the rising awareness and focus on preventing HAIs like VAP, and simply the growth in ICUs and the number of patients needing ventilators.
And on the flip side, what's holding the market back or slowing growth?
Two main things mentioned. First, cost. Making these advanced coated tubes can be expensive, complex manufacturing.
Okay.
Second, regulations. Medical devices face strict requirements, and getting new products approved can be a slow process, which can hinder rapid market introduction.
Understandable hurdles in this space. What about key trends moving forward? What should we be watching?
Definitely the increasing preference for antimicrobial coatings. That seems to be a major focus for healthcare providers.
Right, infection control.
And also, growing adoption of tubes with enhanced lubrication. It sounds minor, but it's about patient comfort during intubation and potentially making the procedure easier for doctors.
Yeah, ease of use and patient experience are always important. Finally, the competitive landscape. Is it concentrated or fragmented?
The report describes it as competitive. You have key players really focusing on differentiating through their coating technologies, antimicrobial, biocompatible, lubricating.
So innovation in coatings is key.
Absolutely. Strategies involve collaborations, acquisitions, and importantly, heavy R&D investment to stay ahead.
Any specific examples of recent innovation mentioned?
Yes, it highlights Medtronic launching its Sonarmed airway monitoring system back in 2021.
SonarMend. What does that do?
It uses acoustic technology sound waves, basically, to listen and detect if an endotracheal tube, specifically in pediatric patients, is obstructed or to verify its position.
So moving beyond just the coating to integrated monitoring tech.
Exactly. It shows the direction things might be heading, more intelligent, integrated airway management, not just passive coatings.
That's a great example. Okay, so let's try and wrap this up. What are the main takeaways from this deep dive?
Well, I think it's clear the coated endotracheal tube market is pretty substantial already and set for strong, steady growth globally. That growth is really being pushed by the need for more surgeries, more critical care, and crucially, a big focus on preventing hospital-acquired infections like VAP.
Right, the safety angle is huge.
Definitely. Regionally, North America is the biggest market now, but Asia-Pacific, especially countries like India and China, is where the really rapid growth is expected.
The 9.2% CAGR in APAC, yeah.
And technologically, the trends are towards more advanced antimicrobial and lubricating coatings, and potentially, like that Medtronic example, integrating electronic monitoring features.
Excellent summary. And that leads us nicely to our final provocative thought. Given this intense focus on preventing HAIs and the constant innovation in materials and sensors we're seeing, how might these tubes evolve next?
Exactly. Could they move beyond just passive infection prevention or comfort?
Could we see tubes that, I don't know, actively diagnose issues in real time beyond just position or obstruction, or maybe even deliver targeted medication directly to the airway?
It certainly seems plausible down the line, combining advanced materials with microelectronics and maybe even targeted drug delivery. It opens up some really interesting possibilities for the future of airway management. Definitely a space to keep watching.
Indeed. Lots to think about there. Thanks for joining us for this deep dive.